what we found was that patients who were able to see the same GP frequently, compared to those that saw a different GP every time they went to the doctor, had almost 60% less chances of being incontinent, 35% less chances of developing delirium the next year, which are both conditions that affect quality of life significantly, and delirium has terrible prognosis in the subsequent years. And they were also 10% less likely to be admitted to hospital with an emergency, during an emergency. So you had, in terms of health outcomes, a significant improvement to those that saw the same GP. They also had they were also prescribed less number of medications, so a smaller burden of medications, and less drugs that are deemed to be potentially inappropriate. Treatment of people with dementia is important because dementia rarely occurs by its own. You usually have additional conditions with it. Those people are elderly, usually at least have hypertension, but can have other things. So it's the ability to manage this complex regime of medications where you're treating multiple conditions at the same time that becomes quite problematic. And here, continuity, which is seeing the same GP every time you go to the doctor, and building that rapport and relationship with the doctor becomes quite important in how you manage the conditions, all of them. I do think that the big impact this has is not necessarily treating the dementia, it's treating the dementia and the additional conditions that they have. It's the complexity of the treatment that requires the doctors to be more on top of the patient. And that's why it's so important.